The purpose of the back and neck pathway was to try and provide good spinal care for patients in Suffolk. The aim was to try and get patients quickly into physiotherapy to try and help manage their back pain, but also with certain spinal conditions to get them into secondary care quicker for invasive treatments such as injections or spinal surgery. There are a number of red flags that potentially may indicate more serious pathology and need secondary care assessment. Probably the most serious one is that of cord requiner, which is a autonomic dysfunction of the bladder, which may lead to incontinence or retention, and that would need a secondary care opinion. There are other possible red flags such as previous history of cancer, particularly prostate, breast, lung and thyroid, that may again indicate an earlier investigations and within secondary care, and they may need more urgent assessment, particularly if there are other features such as weight loss, night pain, severe pain. Other possible red flags are progressive neurological deficit, which also needs probably a more urgent secondary care opinion. There are age criteria that are used for red flags. However, we are now seeing more younger people with back pain and a lot of elderly patients with mechanical back pain, stenosis, which are not red flags. But with increasing age, that increases the likely risk of a potentially more serious pathology. To help manage acute spinal patients in primary care, it's important to give reassurance. The majority of patients with back pain, it is non-serious, and to give them that reassurance is very important. It's also important to give them good pain relief, so good painkillers, anti-inflammatories can help to ease their pain so they can stay active. It's also important to encourage them to stay as active as possible, but they may have to back off a little bit from their usual activities in the very acute phase. Patients with chronic low back pain and who are having difficulty staying in work is very difficult. They often need much more help in terms of general rehabilitation, but often also some psychological help as well. They can be referred into physio for chronic back pain programs, Pilates, general exercise, but also they often need some help either from a pain clinic or a community pain service, or from Suffolk Wellbeing to help manage their pain better. It's very important for patients with spinal pain to keep active and if possible, stay at work. Often in the acute stage, when the symptoms are very painful, and sometimes they may have to adjust their day-to-day lifestyle, and for some they may have to have a short period of time off work. But if we can encourage activity and staying at work, that would be best for the patient in the long term. They may have to speak to their employees to see whether they can have slightly reduced activity levels at work, possibly reduced hours. But again, to try and keep them active and at work is very important. If a patient presents in your practice with sciatica, it's important to realise that it is a very painful condition, and but it's important to give them good pain relief with either anti-inflammatories, codeine-based drugs, or possibly anti-neuropathic drugs such as amitriptyline or gabapentin, which our pain clinics do recommend. It's also important to keep them active, and a quick referral to physiotherapy is also advisable to encourage movement, but also to give them reassurance and advice on overall management of these kind of conditions. 90% of patients with sciatica will resolve with time and physiotherapy, and there is often no need for any invasive treatment such as injections or surgery. You'll be kept up to date on your patient's progress by the physiotherapist if they're being treated in one of our local clinics. They will write to you with discharge letters as needed. If they are referred into the back and neck service, we will write to yourself following our initial clinic appointment and following any subsequent reviews of that patient. You will also receive letters from our multidisciplinary team meeting. That includes our spinal surgeons and our pain consultants. This information will be sent to you immediately after the multidisciplinary meeting to say exactly what's happening to the patient, whether or not they're being referred into secondary care, whether they're continuing physiotherapy, or whether they're being discharged.